I'm Sarah Richardson, a principal here at This Week Health, where our mission is healthcare transformation powered by community. This is Flourish Soundbites, unfiltered conversations with healthcare leaders. Let's get real.
Laurie, so good to see you here at SOAR. Here we are at SOAR 2025. Hey, we are live from SOAR 2025 in Boulder, Colorado, and I'm joined by Laura and Amy. Hey, we are live at SOAR 2025 from Boulder, Colorado. I am joined by Allie and Erica with some very important questions. Ladies, are you ready?
Superpower swap, ladies. What superpower would you bring to work and how would you use it? Yeah, I would like ESP, power to read minds, to be able to transfer my thoughts into somebody else's head. That would be my superpower.
I feel like if I could just snap my fingers and have research be done in a second. I feel like I don't spend enough time doing the necessary work because I'm just bogged down with other things. And I feel like somebody talked about that yesterday or today, where it's just being able to be intentional about doing that type of research, or whatever it is, even if it's just a new policy that came out or a new product that came out or something like that.
Mine would be to be in multiple places at the same time. I don't know if you remember the movie Multiplicity, but I think they should redo that one because it was an old 80s movie. But multiplying myself.
Who outside your field taught you something powerful and what was it?
I will say my oldest child taught me the strength and individuality. And as they've grown through their life and made choices in their life to become the person that they want to be, I have nothing but admiration for the strength that my kid has had. So
That's powerful as a mom.
it is pretty, it takes your breath away sometimes.
I think that my mother has been one of my mentors. She taught me how to work hard and hustle and have grit and commitment. I think that I grew up with someone who was working all the time, but was present as a mom as well, but showed me professionalism and to believe in myself.
In fast-changing times, how do you decide which opportunities to pursue and which ones to avoid?
Really just tapping into resources, people like you, other people that have experience in the industry and what has worked for them, and also tapping into resources as far as learning more, what's coming with AI, and what we should pay attention to and what we shouldn't. Maybe not be the first out of the gate. Let some other people understand and feel the water before we jump all in.
Research and just keeping a pulse on what's happening in the news, specific to healthcare, right? Because things are ever changing and very quickly to change. So research and keeping a pulse on the news, like This Week Health. What defining moment changed how you lead or who you are as a leader?
I would say defining moments was when I was told that I would start managing someone underneath me, which was brand new to me. And it helped because they were asking questions that I probably should have been asking myself about how I do what I do. It was that classic do as I say, not as I do type of situation. So that was a huge turning point, and I just became more comfortable with being more open about my process and just getting better myself.
I go back to a time I had in 2011. I went to a leadership academy over in Italy, and we literally climbed mountaintops, literal, and then we talked about it figuratively. And so the comments made today about needing to bring people up to the top with you, that stuck with me, in both the exercise of actually going with a team up a mountain together, but also understanding that when you get to that pinnacle top, you really want to be surrounded with peers and people, like-minded.
I think it changed when I was asked to sell, I was in sales, and I was being asked to sell a product that was not ready to be sold, and I didn't want to burn my reputation for the people around me with that, and it was really critical to stay true to my values and my principles and move forward from there.
What place visited or a dream destination feels like rest for you and why?
New Zealand. I've been in New Zealand 3 times. We have a customer in New Zealand, and every time I go there, the people there just, everything slows down in the best way, and it's such a beautiful country, beautiful people. So every time I come back from New Zealand, it's like I'm a totally relaxed, chill person, and try to spread that around and tell people why their culture is so great and how we can learn from it.
Sarah and I recently went on a river cruise, a wine river cruise down the Rhine River, which was really nice. I'm not a big cruiser, but the river cruise was a completely different aspect. But Sarah and I are avid scuba divers, and Cosmo, when was that, July?
May.
Yeah. That was amazing. I need that again. And it was a great reset, recharge, just what the doctor ordered.
For me, it's going to be, I would say, anywhere on a cruise. I really enjoy cruising a lot, and I just find it to be a very fun, relaxing experience where ideally you could disconnect, although I'm not always great about doing that, but it's also a way to see a lot of different places, in one vacation.
What impact do you hope to leave, especially for women and underrepresented leaders?
I think it's how the team or how my staff, how you made them feel. And I want them to have this feeling of, I had someone who believed in me, who supported me, and who helped me be better. And that's really kind of the legacy and the kind of impact I want to have, because everyone deserves that chance. All of the upcoming women leaders, just all of the underserved, they just need a champion in their corner. Yeah. And I think as we grow in our roles, the biggest piece you can do is give back. And you can help mentor and support other upcoming women leaders.
I hope I can be an example, a model for other women and underrepresented leaders, help them, guide them, demonstrate to them how we can continue to succeed. So we don't have to have this conversation anymore about gender parity or any other type of diversity within technology, because we're just so well represented and have so many seats at the table.
I'm such a people person, a relationship person, a community person, connection, both professionally and personally. So I just hope that I can continue being a connector of people and connecting them to greatness, whether that is like-minded people or great opportunities, anything like that, to just take all of us to the next level.
The impact I want to make is that I had a hand in lifting others up, and that I had a hand also in encouraging women especially to take risk, because we are so inclined to not do so. But no ton of hearts are really happy to say, yeah, jump in, I got that. I have 50% of that, the expectations for that role, I'm in. And women tend to just try to check all the boxes before we're ready. So being able to encourage and have a hand in helping you succeed.
Thank you so much. So glad to hear.
Really great speaking.
Yeah, thanks so
Thank
much.
you.
Thank you, ladies, for your wisdom. Thanks for joining us at SOAR.
See ya.
Thank you. Thank you so much for being here.
Yes, thank you so much.
Of course. You heard it here from SOAR. Help others to the top and make sure they're following you on your way there. Thanks so much for joining us. That's Flourish Soundbites. Find your community at thisweekhealth.com/subscribe. Every healthcare leader needs a community to learn from and lean on. Share the wisdom. That's all for now.